Hello teammates. As you begin training, I want to personally thank you for your commitment to Harbor. I understand there is significant change when launching this new, integrated, coordinated, and patient-centric way to provide care. And I want you to know that I believe each of your roles is crucial for our successful implementation. Harbor is a significant investment for our organization. In fact, this is the second largest investment we've made in any project since we became Roper St. Francis in 1998. This is a step that will impact the health of our children and even our grandchildren, and I'm very excited to get started. Thank you for your support of this important initiative.
I guess what I'm most excited about with Harbor coming to us is that our physician's orders will now be electronic, and we have less hands that have to touch the orders, and less medication errors and better patient safety overall.
I'm very excited about the Harbor initiative because now the patient's whole picture will be at our fingertips. Also, we will not have to read doctors' handwriting.
So what I'm most excited about with Harbor is the fact that so many times patients' information is sequestered or siloed in one particular area or another, and no one can get to someone else's work when they work at the hospital. And this will create an interconnectivity of information, as I understand it, and that will be good for everybody.
As a labor and delivery and postpartum nurse, I am so excited that we will now be able to document medication administration and patient care all in one system.
At my age, I have a GP and 8 specialists. They all prescribe treatment for me. With Harbor, the right hand knows what the left hand is doing, and that's great for me and Roper St. Francis Hospital.
When I first came to work at Roper St. Francis about 12 years ago, one of the first meetings that I went to during that time was a very high-level patient safety meeting. At that point was my first opportunity to learn how fragmented the healthcare delivery and information systems were, and that the number one patient safety issue at that point was considered the need to create a single electronic medical record for our patient care providers. I am very happy to be part of a project that actually brings that dream now into fruition.
I think what makes me excited about Harbor is the fact that the physicians will now put their own orders in as far as, like for instance, labs go, which makes it more efficient and streamlined.
In the emergency department, we're particularly excited about the implementation of barcode scanning for both medication administration and lab specimen collection. This is an added safety feature that will assure that our patients receive the right care every time.
After a hospital stay, sometimes you're not really assured of everything that you hear from the doctors and the nurses. Therefore, having that information online once you get home makes it even better that you can understand what you're supposed to do and how you're supposed to take your medications.
I am so excited about Harbor and what it means to me in my job. It will take the stress out of entering physician orders, all the faxing, scanning, not to say at least all the paper. I can't wait till we're all electronically joined.
I'm looking forward to the new electronic record. As a documentation specialist, we read all the document, and to get the physician's legibility, this will be so much easier.
Pharmacy is very much looking forward to the Harbor project. We received over 26,000 order clarifications last year, so we are looking forward to increased efficiency, decreased order clarifications, and a decrease in medication errors.
What excites me the most about the Harbor project is the electronic order entry for physicians. The fact that the physician's orders will be legible and clarified makes a world of difference for our patients' time. In an outpatient setting, they're just ready to go home.
It is so exciting to have evidence-based care incorporated into our clinical workflow.
Our peri-op team is most looking forward to having one integrated patient electronic health record where we're able to access all of our patients' information using one logon.
I'm a registered dietitian, and the nutrition department is most excited about the ease with which we can capture severe malnutrition in our hospitalized patient population.
As a labor and delivery nurse, I'm super excited about the ease of transition from mom's chart to baby's chart.
I'm excited about Harbor because it's going to give me real-time access to patient information, which will help me make the best medical decisions possible.
As an oncology pharmacist, I'm looking forward to 200+ oncology order sets based on national guidelines.
Harbor is the foundation that will take us into the future.